Well, as the world focuses now on the COVID-19 pandemic, there is another health crisis that we should never forget, the AIDS epidemic. Today is World AIDS Day.
San Francisco in the 1980s was considered the epicenter of the AIDS epidemic. In 1982, the city and county of San Francisco worked with health officials to develop the San Francisco model of care to research and treat this deadly and mysterious virus at the time.
There was a period of intense anxiety. We didn't know anything about it. We didn't know how to diagnose it. We didn't know how it was transmitted. We didn't know what the incubation period was. We didn't know that we weren't already infected.
That year, San Francisco General Hospital opened the first AIDS clinic. Allison Moed was the head nurse of the clinic at that time, known as Ward 5B.
We were excited and we were expectant. And we just were waiting for those patients to come in so we could take care of them. I don't think we could have believed or imagined what it was really going to be like. The numbers that would die, the ways that people would sicken, the grief, the sadness.
Yeah, those were really difficult times, and it's really been 40 years since all of that started. For more now on how far we've come since the beginning of the AIDS epidemic, we're joined by Terry Beswick.
Terry is the executive director of the GLBT Historical Society Museum here in the city. Terry, thanks for joining us. Here we are 40 years later. Where do we stand in the fight against AIDS, public perception of all of this? Where do you think we sit right now historically?
Yeah, thank you so much for having me. You know, I look back to when I first moved to San Francisco from Monterey County in 1981. I was 21 years old, and that's when the first cases of what later became known as AIDS were reported. And, you know, little did I know what a huge impact it would have on my life. I live in the Castro, and, you know, when you think about it, you know, there were thousands and thousands of people who were impacted by AIDS who became infected and who died. And, you know, it's hard to not make a comparison to the current epidemic that we have, that we're dealing with worldwide, and the huge changes that have happened to our culture and our economy, but the amazing number of people that have been impacted by that disease, and compare it to AIDS. And, you know, back then it may have been a smaller group of people, but for the people who were impacted, like gay men, gay and bisexual men, people of color, IVDU people in particular, it was like almost everyone that you knew was infected or knew somebody or loved somebody who was infected and became sick, and many became sick and died. And so, you know, when you think about the impact worldwide that we're experiencing right now with COVID, it was very much like that back then, and it has continued. So, you know, AIDS is not over. There are many, many millions of people who are still impacted who don't have access to care around the world. We have effective treatments now in the United States, and of course we have tests. We don't have a vaccine yet. This is a much more difficult virus to attack and to develop a vaccine for. And so, we're still hopeful that we're going to have a cure for AIDS and a vaccine for HIV. But right now, all we have is prevention through PrEP, antiviral treatments that have helped to keep me alive for decades since I was infected with AIDS in the 1990s.
So Terry, you know, AIDS has such a painful past. I mean, going back to the understanding of it here in San Francisco, and then of course spreading around the world, and then the effect on babies and families and whatnot. But San Francisco really led the way in terms of turning things around. Just give me a quick summary or a quick reflection looking back at those early days and how much changed since then, if you can do a summary on something like that.
Yeah, sure. You know, the gay community here in San Francisco, you know, we really took matters into our own hands and formed so many organizations in the mid-1980s, the early 1980s, to really take care of our own, because the federal government during the Reagan administration was really negligent and was not helping to educate young people about, you know, about the virus that was killing so many young people. And so, you know, so we formed the institutions, and we partnered with the medical community in San Francisco and around the country to really form the institutions that could do the research and to provide the care and treatment and prevention that we needed to stay alive. And so we had to do what we had to do, and we also formed activist groups that would demand more
Yeah.
change and more funding. And I really think that we would be much worse off if we hadn't formed those models of care and research and learned so much about viruses and about the immune system through our work on HIV and AIDS. With COVID, now we would be much worse off. And so I think I'm really proud of what the gay community in particular did in San Francisco, and what the medical community did in working with us. And it's amazing to see, all the healthcare providers and the researchers and the volunteers in clinical trials right now with COVID, which really brings me back to the days of HIV and AIDS, when so many people were volunteering to try to provide care and develop new treatments.
It was really an unprecedented mobilization.
Right.
Remember, I mean, it was amazing.
And it affected, people outside the gay community
Yes.
who had loved ones, and the stigma back then, the homophobia back then, that it was only a gay man's disease, which, was not true and unfair. Talk about the quilt now. The quilt, of course, created while this was all happening, and tell us what's going on with it today and why it's so important.
Yeah, I'm so excited. In the last year, the AIDS Memorial Quilt, which Cleve Jones founded here in San Francisco, and there are tens of thousands of quilt panels that have been assembled together. There have been amazing displays at the National Mall in Washington, D.C., and smaller displays all around the country over the years. But it's been warehoused in Atlanta, and now it's been brought back to San Francisco, into the Bay Area. And the National AIDS Memorial Grove has adopted the quilt, and has a wonderful new display up on their website today that you can explore. And I was looking at it today, and it's you just browse around and you run across somebody that you knew, and it's really powerful. There's no substitute for being able to walk out on the actual physical quilt, I think, but being able to look at what their loved ones of people who have passed from AIDS have assembled with this amazing, largest work of art in the world, folk art in the world, and to do that online is really wonderful. So I
Terry,
encourage everyone to check that out.
real quick, we're running out of time. What
Yeah.
is the one main thing that you would like to see done as you look ahead, in the near future? Obviously a cure, but what else?
I'm
Quickly.
excited. Actually, I'm excited that we have a new president who's going to speak to the people directly about what they need to do to protect themselves and their loved ones from this new disease. Because when we had that missing during AIDS, I think thousands of people died unnecessarily, and it breaks my heart to see that happening now around the country with COVID.
Terry Beswick, thank you so much for your perspective on this very important day, looking back at what's happened and where we need to go.
Yeah, thank you.
Appreciate it.
Thank you for having me.
You bet. And on this World AIDS Day, researchers are seeking approval for a new drug they say is a game changer against HIV. The drug is called cabotegravir and is currently in trials in South Africa. The drug, which is injected, only needs to be taken once every 8 weeks to prevent the risk of new HIV infection. Results so far show the drug to be 89% effective, especially among women.